12 symptoms of pancreatic cancer that will shock you. Most of us are enveloped in the shadow of fear when we hear the word cancer because it is a disease that often lurks inside the body without us even knowing. But when we talk about pancreatic cancer, there are a lot of visible symptoms that can warn you about the deadly disease. Today, in this video, we are going to discuss 12 such symptoms of pancreatic cancer that will shock you. So, without further delay, let's start the video. But if you don't know, then let me tell you that pancreatic cancer is a serious disease that occurs when abnormal cells in the pancreas start growing uncontrollably. Many people have fallen prey to this cancer. The reason for this is an unhealthy lifestyle and carelessness in eating habits. Early detection of this cancer can help reduce the risk of death. The 12th most common cancer worldwide is pancreatic cancer, which results from abnormal growth of cells in the pancreas. The pancreas is a part of the body that helps control digestion. Among other things, it secretes hormones that regulate blood sugar. This cancer can be fatal, so it is important to know complete information about it. It is worth noting that there are two types of cancer. One is exocrine pancreatic cancer. These include adenocarcinoma and neuroendocrine pancreatic cancer. Exocrine pancreatic is the most common type of cancer, accounting for approximately 95% of cases. Exocrine pancreatic cancer begins in the exocrine glands of the pancreas, which produce digestive enzymes. Neuroendocrine pancreatic cancer is the least common type of pancreatic cancer, accounting for approximately 5% of patients. NETs begin in hormone-producing pancreatic neuroendocrine cells. Pancreatic cancer is the most serious cancer and can spread to other parts of the body. According to the American Cancer Society, ACS, avoiding pancreatic cancer is not easy because it first spreads to the stomach and liver, then begins to spread to the lungs, bones, brain, and many other parts of the body. Symptoms of pancreatic cancer. Now, let's talk about what are those 12 symptoms you would need to keep a check on to avoid the serious impacts of pancreatic cancer. Number 1, indigestion. Indigestion is a common feeling, but it can sometimes be a sign of pancreatic cancer. There are a few things to look out for that might be different from regular indigestion. The pain from pancreatic cancer, indigestion is usually felt higher up in your belly, behind your breastbone, and it can even spread to your back. It can feel like a burning feeling, pressure, or a gnawing pain. Regular indigestion might come and go, but this type of indigestion caused by cancer might be there all the time, happen a lot after you eat, or even wake you up at night. Over-the-counter medications that normally help with indigestion won't likely be very helpful for this kind of pain. There are a few reasons why pancreatic cancer can cause indigestion. The pancreas normally makes enzymes that help digest your food. If there's a tumor in the pancreas, it can mess with how many enzymes are made. This can lead to fats and proteins in your intestines not being digested properly, which can cause discomfort. The tumor can also irritate the organs and tissues around it, which can cause inflammation and indigestion. Finally, the pancreas sits right next to a tube called the bile duct, which helps with digestion. If the tumor presses on the bile duct, it can block the flow of bile and cause indigestion and other digestive problems. Number 2, tummy pain or back pain. Abdominal pain or back pain, or sometimes both, are symptoms of pancreatic disease. Pain may begin as discomfort or tenderness in the abdomen and then radiate to the back. Some people have no pain, and the level of pain varies from person to person. For example, it may come and go at first, but it passes forever. It may be worse while sleeping. Sitting in the front sometimes makes you feel better. It may be worse after eating. If you have unintentionally lost weight and have stomach or back pain, your doctor should send you for an urgent CT scan or ultrasound scan within 2 weeks. Number 3, changes to your poo. Pancreatic cancer can cause loose bowels and obstruction. If you have the runs for more than 7 days and you don't know why, your GP. If you have misplaced weight and have runs or clogging, your GP ought to elude you for a critical CT check or ultrasound filter within 2 weeks. Pancreatic cancer can too cause pale, sleek poo. This is called steatorrhea. Poo may be expansive, bulky, scent appalling, and may drift and be troublesome to flush down the can. This is caused by fat in the poo. It happens if pancreatic cancer has influenced your assimilation so that fat in your nourishment isn't processed appropriately. Number 4. Weight loss. Losing a part of weight without meaning to can be an indication of pancreatic cancer. The pancreas plays a critical part in processing nourishment and controlling your blood sugar levels. Pancreatic cancer can influence this and cause weight loss. If you have misplaced weight and don't know why, you ought to see your doctor to discover what is causing this. Your doctor ought to allude you to have a pressing CT check within 2 weeks if you have lost weight and have any of these side effects, which are tummy or back pain, feeling sick or being sick, diarrhea, runny poo, constipation, or you have been diagnosed with diabetes in the last year. Number 5. Jaundice. Jaundice happens when a waste product called bilirubin builds up in your blood. Normally, your liver gets rid of bilirubin, but sometimes this process gets blocked. Pancreatic cancer, especially in a certain area of the pancreas, can be the culprit. This blockage stops bilirubin from leaving your liver and causes it to build up in your blood. The extra bilirubin leaks into your skin and eyes, making them turn yellow. Here are some signs of jaundice caused by pancreatic cancer. Your skin and the whites of your eyes turn yellow. This yellowing often starts in your eyes and then spreads to other parts of your body. It might be easier to see in the whites of your eyes if you have darker skin. Your urine gets dark. Normally, bilirubin is removed from your body through your urine, but a blockage can make your urine turn dark yellow, amber, or even brown. Your stool turns pale or greasy. Bile helps digest fat and gives your stool its normal color. Without enough bile, your stool may lose its color and look pale, clay-colored, or greasy. Your skin itches all over. The bilirubin buildup in your skin can make you itch all over your body. This itching can be very uncomfortable and make it hard to sleep. Number 6. Losing your appetite. Loss of appetite and decreased desire to eat may be symptoms of pancreatic cancer or may be due to other reasons. If you lose your appetite and don't know why, talk to your family doctor. Diabetes is a disease in which blood sugar is too high. The pancreas produces a hormone called insulin that helps control blood sugar. Pancreatic cancer prevents the pancreas from producing enough insulin, leading to diabetes. Symptoms of diabetes include feeling very thirsty, peeing more often than normal, especially at night, losing weight quickly, feeling teary. If you have been diagnosed with diabetes in the last 6-12 months, please talk to your doctor. If you have lost weight and have recently been diagnosed with diabetes, your doctor should send you for a CT scan within 2 weeks. Number 7. Problems digesting your food. The pancreas plays an important role in digestion. Eating and digestive problems are common in pancreatic cancer. Symptoms include nausea, bloating, intense gas, and burping immediately after eating. However, these symptoms may also be side effects that are not usually caused by pancreatic cancer. Number 8. Changes to bowel habits. The pancreas is a very important part of your digestion system, kind of like a special juice maker for your gut. When you have pancreatic cancer, it may not be able to make enough of these digestive juices. This can cause problems with your bowel movements in a few ways. The most common problem is diarrhea, which means you poop more often and it's loose and watery. Sometimes it might also be greasy or oily because your body isn't breaking down fats properly. You might also get constipated, especially if the cancer is blocking the way for your poop to move through your intestines. In some cases, you might even feel a sudden urge to go to the bathroom or have trouble holding it in. Your poop itself might look different too, maybe pale or clay-colored or bulky and greasy. There are a couple reasons for these changes. Normally, the digestive juices from your pancreas help break down your food. Without enough of these juices, your body can't absorb fats, proteins, and carbohydrates properly, which leads to diarrhea and greasy stools. If there's a tumor in your pancreas, it can also block your poop from moving through your intestines normally, causing constipation. The tumor itself can irritate your intestines too, which can lead to problems like feeling like you urgently need to go or having trouble holding it in. It's important to remember that not everyone with pancreatic cancer will have bowel problems, and these problems can be caused by other things too. But if you notice any changes in your bowel habits that don't go away, it's always a good idea to see your doctor to get checked out. Number 9. Blood clots. Pancreatic cancer can cause blood clots in the veins. This is called deep vein thrombosis, DVT. Blood clots usually occur in the lower extremities, but can also occur anywhere in the arms or legs. Some people do not have symptoms of blood clots. Some may have some pain, swelling, or redness in the nerve area, and the affected area may be tender to the touch. If you have these symptoms, it is important to contact your doctor immediately. These symptoms may be caused by other causes but are worth checking out. Sometimes a part of the artery can break the lung, causing a blockage. This is called pulmonary embolism, PE. This is very serious and can cause shortness of breath or chest pain. It is important to see your doctor if you have these symptoms. Alternatively, if you cannot contact your doctor, go to the emergency room. Number 10. Depression and anxiety. Pancreatic cancer is linked to depression and anxiety for a few reasons. First, getting a cancer diagnosis can be scary and upsetting, leading to feelings of sadness, anxiety, and hopelessness. This is normal, but if these feelings are very strong and don't go away, it could be depression. Second, pancreatic cancer itself can make you feel physically bad. Pain, tiredness, and trouble eating can make it hard to sleep and cope with daily activities, which can also lead to depression and anxiety. There's some new research that suggests there might even be a biological reason for this connection. The pancreas helps make hormones that affect your mood, and cancer can disrupt this system. In some cases, depression or anxiety symptoms might even show up before any other signs of pancreatic cancer, which can make it trickier to diagnose the cancer early. Number 11. Gastrointestinal issues. Pancreatic cancer can cause a lot of problems with your digestion. Normally, your pancreas releases enzymes to break down food in your intestines, but when you have pancreatic cancer, it can make it hard for your body to do this. This can lead to a number of problems, including diarrhea, gas, bloating, cramping, nausea, vomiting, and feeling full after eating even a small amount. It can also make you lose your appetite and make it hard to keep food down. All of this can lead to weight loss. Fatty foods can be especially difficult to digest because of this problem. Number 12. Gallbladder or liver enlargement. If the cancer blocks the bile duct, bile can build up in the gallbladder, making it larger. Sometimes a doctor can feel this during a physical exam. It can also be seen on imaging tests. Pancreatic cancer can also sometimes enlarge the liver, especially if the cancer has spread there. The doctor might be able to feel the edge of the liver below the right rib cage on an exam, or the large liver might be seen on imaging tests. Early signs of pancreatic cancer. The initial sign of cancer is pain in the upper part of the stomach, which spreads to the back. Apart from this, many physical problems can occur like jaundice, itching in the skin, dark-colored urine, loss of appetite, uncontrolled diabetes, nausea and vomiting. Feeling weakness in the body and the formation of blood clots are common signs. People aged 45 years or older are at greater risk of developing pancreatic cancer. This cancer occurs more in men than in women. Apart from this, unhealthy food, smoking and obesity also increase the risk. While these symptoms can be indicative of pancreatic cancer, they can also stem from various other conditions. However, if you experience any of these symptoms persistently, or if they worsen over time, it's essential to consult a healthcare professional promptly. Early detection and treatment offer the best chance of managing pancreatic cancer effectively. Therefore, being aware of these symptoms and seeking medical advice promptly can potentially save lives. Additionally, individuals with a family history of pancreatic cancer or other risk factors should be particularly vigilant and proactive in monitoring their health.
Now we saw in the video what can be the symptoms of pancreatic cancer.
Now in the video, we will know that eating which foods can reduce the symptoms of pancreatic cancer. Number 1 is lean protein sources. During pancreatic cancer treatment, your body needs extra support to heal and fight off infection. That's where lean protein comes in. Protein acts like building blocks to repair tissues and muscles, which can get broken down during treatment. It also helps your immune system stay strong, which is important because treatment can make you more likely to get infections. On top of that, protein can help you feel fuller for longer, which can be helpful if you're having trouble eating. Here's the good news. There are many delicious ways to get lean protein into your diet. Chicken, turkey breast, and fish are all great options. You can bake, grill, poach, or steam them to keep them healthy. For fish, fatty choices like salmon and sardines have extra benefits because they're high in omega-3 fatty acids, which can help fight inflammation. If you prefer whitefish, cod, tilapia, and halibut are all good choices. Eggs are another easy and affordable protein source. They're a complete protein, meaning they have all the building blocks your body needs. You can choose whole eggs or egg whites for a lower fat option. Looking for plant-based protein? Beans, lentils, and chickpeas are all full of protein and fiber. You can add them to soups, salads, dips, and stews for a filling and nutritious meal. Soy products like tofu and tempeh are also good sources of plant-based protein. Tofu has a mild flavor that absorbs seasonings well, while tempeh has a nuttier taste and a firmer texture. Don't forget about dairy. Greek yogurt, low-fat cottage cheese, and low-fat milk can all provide protein along with important nutrients like calcium and vitamin D. Choose plain varieties and add your own fruit or flavorings for a tasty snack. Here's a tip for managing your appetite. Aim for small, frequent meals throughout the day. This can be easier to handle than forcing down large meals, especially if you're not feeling very hungry. Finally, remember that variety is key. Include different protein sources throughout the week to make sure you're getting all the important nutrients your body needs. Number 2 is colorful fruits and vegetables. There isn't one magic food that can cure pancreatic cancer, but eating a colorful variety of fruits and vegetables can be a great weapon to help your body during treatment. These bright colored fruits and veggies are packed with helpful ingredients that can give you many advantages. First, fruits and vegetables are full of antioxidants like vitamins A, C, and E, along with carotenoids and flavonoids. These antioxidants act like tiny shields that protect your cells from damage by free radicals. Free radicals are unstable molecules that can harm healthy cells and cause inflammation, which is linked to cancer. By reducing free radical damage, antioxidants may help keep your cells healthy and potentially lower your risk of cancer. Many fruits and vegetables also have natural anti-inflammatory compounds, like curcumin in turmeric and resveratrol in grapes, berries, and peanuts. Long-term inflammation is linked to various cancers, including pancreatic cancer. By eating fruits and vegetables with these anti-inflammatory properties, you may help reduce inflammation and potentially make it harder for cancer cells to grow. Fruits and vegetables are also excellent sources of fiber, which is important for good digestion and may also play a role in preventing cancer. Fiber helps regulate blood sugar levels and can keep you feeling full for longer, so you might eat less overall and maintain a healthy weight. Obesity is a risk factor for pancreatic cancer, so staying at a healthy weight can be beneficial. A strong immune system is important for fighting off infections and diseases, including cancer. Many fruits and vegetables are loaded with vitamins and minerals, like vitamin C, vitamin K, and folate, which are essential for a healthy immune system. By giving your body these essential nutrients, you might be helping your immune system work better. Number 3 is healthy fats. Having healthy fats in your meals is very important when dealing with pancreatic cancer. Even though your pancreas helps digest fat, some fats are actually good for you during treatment. Here's why healthy fats are important and some great choices to add to your diet. Energy boost. Healthy fats are a concentrated source of energy which your body really needs during cancer treatment. It's easy for your body to use this energy for many things, including keeping your cells healthy and your immune system strong. Better digestion. Healthy fats can help your body absorb important vitamins and nutrients from other foods you eat. This is especially helpful for people with pancreatic cancer
who may have trouble digesting food because of the disease or its treatment. Less inflammation. Certain healthy fats, like omega-3s, can actually fight inflammation. Inflammation can make cancer worse, so eating these fats might help control inflammation and make you feel better overall. Feeling full. Healthy fats can help you feel full and satisfied after eating, which can help you manage your weight. Staying at a healthy weight during cancer treatment can be good for your overall health and treatment results.
So, guys, that's it for today's video. I hope you will have got a lot of information and value from it. Please hit the like button and share this video with your loved ones. Also, don't forget to hit that subscribe button for more such videos. Thanks for watching.